Good morning, or afternoon, or evening, depending on where you are or what time of day you're doing the mini foot treatment. So what I'm going to need for you to do first of all is take a sip of water, because we always want to stay hydrated as we're doing fascial work and melt. The body will start to pull fluid from the tissues and through the tissues within 3 to 5 minutes of doing this work. So making sure that we're adequately hydrated will help better tissue distribution throughout our body as we do this work. So we're going to take our large soft ball, we're going to tuck it aside for just a minute, put it in your pocket or keep it wherever it is. Let's do our standing assessment. So I'm going to look down at my feet, make sure that my toes are lined up in a straight line. Feet are hip width apart. And then I'm going to stand up. I'm going to make sure I don't fidget, keeping my hands relaxed at my sides. This is not a mountain pose. Nice and relaxed. Shake it out if you need to. Take a breath, close your eyes. Let go of any unnecessary tension you might be holding in your body. So I want you to check. Are you squeezing your glutes? Let it go. Are you squeezing your thighs? Let them go. Are you locking your knees? Seeing if you can soften them. Now, pay attention to your footprints. Do you feel like you are standing more on one foot than the other? How much contact does each foot have with the ground? Are you more standing on your heels, or are you leaning forward over the balls of your feet? Notice what you feel. Now, I want you to scan up your body the rest of the way for a moment, and I want to see if you can notice where your arms are. Does it feel like one arm is closer to your body than the other? Does it feel like one arm hangs longer than the other? And again, thinking back to where you were with lining your feet up in a straight line, does it feel like your feet are in a staggered stance? Even though you knew that you put them side by side, straight line of your toes, does it feel like one foot is standing in front of the other? If so, it's not a crisis. It's just letting us know that your autopilot is sensing difficulties connecting to your center of gravity. Go ahead and take a breath in. Open your eyes, and we're going to see what kind of changes we can make. So you have your large soft ball. We're going to put it down on the ground, and you can do your left foot. I'm going to do my right foot, so it looks like we're doing the same. And I'm going to stand next to the ball. I'm going to line the ball up with the center of my foot that I'm going to work on. I'm going to cover the ball with my foot, standing on the ball of my foot, compressing down on the ball. So I'll turn to the side. You can see I'm literally right in the center of my foot. Okay? And then I'm just going to cat paw back and forth like I'm a cat making bread or dough on its favorite blanket. I also feel like I'm doing some sort of hula dance. I need a grass skirt, whatever you want to call it. We're essentially giving our body some sensory input to let it know that we're going to be doing some soft tissue work on it. Now remember, the ball doesn't hurt you. The tools don't hurt you. It's the choice of your pressure that's going to make or break how comfortable you are during this treatment. So if it's too much, back off. You don't need to compress all the way and lift a foot. We don't need to do that. You can just decompress as much as is comfortable. On this next one, we're going to pause here, and we're going to move our joints around in space. I want you to try to wiggle your fingers. I want you to try to move your head around a little bit, as long as it doesn't make you dizzy. What we're doing is we're making our brain connect to our center of gravity. For women, this is our pelvis. For guys, it's our chest. When we're on an unstable surface, meaning when something under our feet is making us feel unbalanced, our brain has to recalibrate and find out where we are. So in this case, even though we're safe, we have 2 feet on the ground, we are standing on a ball, so our brain thinks that we're on uneven ground. It has to calibrate where we're at. Let's go ahead and pause there. Now, I'm going to take a step back with the foot that doesn't have the ball. I'm going to move the ball towards my heel just a little bit. So if I turn to the side, you can see that this ball lines up with my ankle bone. That's about where I want to have it. I'm going to lunge forward, tolerable pressure, and I'm going to come back. And I'm going to lunge forward. My compression is on the ball. Ball is between my ankle bones. Now I'm going to split my weight 50-50. 50% on this leg, 50% on that leg. So if it means I need to lean back a little bit, that's fine. Keeping my forefoot on the ground, I'm going to start to swivel my heel back and forth. This is our glide. So a glide is preparatory in melt. So what this means is it's sending the signal to the receptors in our tissue that we are going to do work, that we are going to introduce mechanical pressure, that we're going to introduce some sort of therapeutic intervention that our body is preparing for. And if that doesn't make sense to you, don't worry, that we're just telling our body that we're going to do some stuff. How about that? Okay, so I'm traveling the ball now back towards my heel. So my foot's going towards you, the ball is going towards my heel a little bit, If you find that you're compensating by leaning onto your back leg to get this foot out forward, don't do that. Lean forward a little bit more and just put your weight over your foot so that way your foot naturally wants to go forward. The ball is coming back towards your heel. Now, pause there. Keep swiveling the heel. My forefoot stays on the ground. And I'm bringing that ball back to where I started, which was between my ankle bones. And once I get there, now I'm going to do my shear, which the shear is a way to squeeze as much fluid as possible into this local area. It's kind of like wringing fluid into a sponge that's been dried out. I'm going to squeeze all that fluid into the tissue by pinning the tissue between the ball and the bone. So that way when I pause, exhale, and I come off the ball, all that fluid lets out, and now I have a bunch of nice fluid going out to the margins of my feet, thus hydrating the tissue. Now, since that's in my heel, it's a local fluid exchange. Let's get that ball to help us rinse the fluid up our tissue, up our legs. So, curl your toes forward. These big knuckles right here is where I'm going to place the ball each time to do my rinse. So I'm going to press on the big toe knuckle. I'm going to stay in a kind of squat stance. I'm going to skate over the ball and come up. Reset. Rinsing is one direction. So second toe, I'm going to squish the ball. I'm going to skate over the ball, come up. Again, this requires a little bit of balance. You'll get better with time, I promise. Third knuckle, I'm going to compress the ball. My knees are bent slightly. I'm going to skate over the ball, and I'm going to come up. I'm going to come back again. Now I'm on the fourth knuckle. I'm going to compress the ball, come forward, come up. If you found that you put your hands on your hip, that's your body telling you that it needs some other sort of touch to find out where is your balance. See if you can do this without your hands on your hips. Squish on the fifth knuckle, skate over the ball, come up. Now, the last technique we're going to do is friction, which is gently, gently, gently scribbling the ball against the bottom of our foot. This stimulates those pre-lymphatic channels, helping all of the lymphatic fluid move along the fascial matrix, helping our body get rid of any sort of metabolites or toxins that it doesn't need. It all works together. Pause there. Feet side by side. Take a little breath in. We won't go through the whole standing assessment again, but I want you to notice, what do you feel in the leg that you've melted? If you do a quick check-in, does it feel like you have more contact on the ground with that foot that we just worked on? Does it feel like you have one seamless leg, whereas the leg we didn't work on might feel like you could identify your ankle, your knee, and your hip? Notice what you feel. Let's do the other side. So I'm going to stand next to the ball. I'm going to line up the ball with the middle of my foot. I'm going to step over the ball with my forefoot and then compress onto the ball. So again, the ball is right in the middle of my foot. And I'm going to grass, hula dance, cat paw, whatever you want to call it, gently moving back and forth. Tolerable pressure, tolerable compression. Nothing about melt should ever hurt. Okay, so we're giving our body some sensory input right now, saying that now we're going to work on this leg. And you might notice that one foot is pretty sensitive compared to the other. That's okay. And if you don't notice any sensitivities, congratulations, you're an anomaly. Seriously though. We're going to pause here on our next one on this compression, again, moving our joints around in space. But why did we do this if we just did it on the other leg? Because we have two legs. Most of us have two legs that we can put a ball under, so we do need to tell our brain to find our center of gravity underneath the other foot, right? To make sure that we know where our pelvic position is. Wiggle your fingers, move your head, move your neck as much as you can without getting dizzy. Then we're going to pause. I'm going to step back with the leg that does not have the ball. I'm going to scoot that ball just back towards my heel a little bit. So if I turn to the side, you will see that that ball lines up with my ankle bones. Okay? I'm going to come forward into a lunge. I'm going to pause. I'm going to come back. Come forward into a lunge again. Pause. Come back. 50% on the front leg, 50% on the back leg. I'm going to swivel my foot back and forth, trying to get that ball to pop out each side of my foot every time I make a little swivel. My forefoot stays on the ground. Why does it do that? We're trying to keep some contact with the ground, because if we're all over the place, what are we doing? We're really working to stay upright and balanced on this leg. We're trying to just get fluid exchange on the foot that we're melting. So I'm moving my foot towards you. The ball is moving back towards me. And this is, again, our glide. We are preparing the tissue for what's to come. Once it gets to the back of your heel, go ahead and start working that ball back. So the foot's coming back towards you. The ball is going back up to where it started, which is between the ankle bones. Now let's do our shear. We're going to tighten up the wiggle. Again, we're working fluid into a sponge, per se, the sponge being our tissue. So that way when we are pausing, we take a breath, and we come off the ball, we'll notice that the fluid kind of perfuses outward. It basically fills in the margins of our feet. A local fluid exchange happens, and now we're gonna rinse the rest of that fluid up our legs. So check to see where that ball is gonna start, underneath the big knuckles of the toe. Compress with the first toe knuckle. We're gonna get into a little squat here, skate over the ball, and come back. Now, if your legs need to be wider to give you more balance, that's totally fine. Let's go on to the second knuckle. Skate over the ball and come back. This also helps our balance, right? We're on the third knuckle, we're gonna skate forward. Now when I move backwards, I don't have eyes in the back of my head, so it does actually help my brain to connect to my body to know that I'm not gonna run into this wall. I have to have body sense to know that I'm not gonna hit the wall. Fourth knuckle, skate over the ball and come back. Fifth knuckle, over the ball, come back. A little bit of balance here. We're gonna stand on one foot. We're gonna gently, gently, gently scribble the ball on the bottom of the foot that we just melted. This is called friction. We're stimulating the pre-lymphatic channels, moving all the fluid around, making sure that it has enough possibility to be uptaken, reuptaken into the rest of the body. We're gonna do that again on each foot. So we're gonna switch. I'm on my first foot that I melted. I'm gonna friction, light scribble here. And then the next foot, scribble, friction, moving all the fluid, giving everything the chance that it needs to get the fluid where it's going. Toss that ball aside. Let's do another check-in. Look down at your feet. Make sure that they are side to side. We are going to close our eyes again. So stand up nice and tall, get the wiggles out, close your eyes, notice what you feel. You might feel a little bit of tingling in your fingers or up your legs, which is great. That is the fluid that's actually traveling along the fascia and in your lymphatic channels that's rehydrating the rest of your body. Does the contact of the ground with your feet change? Do you notice that you have more contact with the surface of your feet? Does it feel like you're standing more centered over the arches of your foot? I certainly do. I don't feel like I'm waving forward and backwards trying to find out where I am. Did you notice that you're not clenching anything as much? So again, maybe as before you were clenching your butt cheeks or your thighs, maybe that's less or not at all. Are your knees unlocked? Do I have to tell you to unlock your knees? Probably not, because they were probably soft to begin with. Scan up your body to your arms. Does it feel like you've gotten a little bit more equilibrium in your arms? Does it feel like if one arm was closer to your body than the other, maybe now they feel evenly spaced? If there's any sort of length discrepancies with what you felt in your arms, does it feel like it's evened out? Finally, bring your awareness down to your feet prints again and notice, does it feel like you are standing in a straight line? Whereas before you might have felt like you were in a staggered stance, now you're in a straight line, meaning that your autopilot has reacquired its signal to your center of gravity. Go ahead and open your eyes. Enjoy those changes. I do this treatment every day. You can do it any time of the day. You can do it, I wouldn't go overboard, a couple times a day, but enjoy.